water bead toys have made headlines due to their dangerous potential to expand 100 times in the body when ingested. So what do parents need to know about the most common choking hazards when it comes to kids?
We're joined now by pediatric ER doctor Megan Cobb, and she's a physician at the University of Maryland Children's Hospital and joins us now to talk about this. Dr. Cobb, thank you so much for joining us. This is one of those things, I guess, the children think they're candy, they eat them, and it's not until there's a problem that you realize that they're a hazard.
Exactly. And it can be even more difficult in that they're so tiny. If you've ever seen them in person, they're literally just sort of tiny millimeters, even smaller than a grain of rice. They're brightly colored. They're touted as a wonderful toy, especially for children that have some difficulty with sensory input, such as children that have autism spectrum disorder. And so they look really entertaining, and they can shove in a handful or even just a couple. But as Sina mentioned, once they expand to greater than 100 times their normal size, they can cause intestinal blockages. And the chemicals that are within the water beads can then also leak into the system and cause neurotoxicity.
And are there other toys or even just like household items that tend to be common choking hazards for kids?
Absolutely. We know about all of the tiny, pieces with toys and Legos and things like that. Still, one of the most common things that we see in the emergency department are kids swallowing coins. They're shiny. They kind of pop in. They're a little bit everywhere. And then on the more dangerous end of that are button batteries, and then their parents' or grandparents' medications.
And doctor, how might you know if a child has eaten something like that? They can't readily tell you. What should you look for?
Sure. So some of the early signs are they're drooling, they're coughing. You may have heard them sort of choking, and then it sounds like they're okay. But then later on, they're not eating, they're not drinking. They may start vomiting, complaining of abdominal pain. And those are the times that we would want you to bring your child into the emergency department, or you can always call poison control, and they are a wonderful resource for parents to know whether or not their child is safe to stay home or needs emergency medical evaluation.
All right. Thank you so much, Dr. Cobb, for joining us and for this helpful information. We appreciate it.
My pleasure. Thanks so much for having me.
Absolutely. We appreciate you.